Good morning, everyone. Welcome to episode 14 of Wake Up with Walters. I hope everyone had a great weekend. It was a beautiful weekend here in New Orleans. First weekend of what should have been Jazz Fest, and really perfect weather. So let's have a few people, let's wait for people to join, and then we'll start talking about liposuction and really some common questions that I get. Can fat return after liposuction? How to maintain your new look? How to maintain your results? And we'll go over all of that briefly this morning, and then also go over some before and after photos. So let's just wait for some people to join, and we'll start talking about common questions I get about liposuction. So I posted in my stories some, people to ask questions yesterday. So we have a bunch of questions we'll go through at the end. If you have any specific questions you want me to ask, feel free to put them in the comments below, and we'll try to get to as many as we can this morning. So grab a cup of coffee, and we'll start in a few minutes and start talking about liposuction. And some people have asked, we will be putting all of these episodes on our YouTube channel. In a few days we will start uploading them. So don't worry if you missed some of the prior episodes, because we'll put most of that on the YouTube channel. So. Okay, well, let's go ahead and start. So first we'll just start about, and just talk about what is liposuction. And, I think most people who are following have some idea of what liposuction is. Liposuction is really just the mechanical removal of fat cells throughout the body. And we pretty much can do liposuction really from head to toe. There are some areas of the body that it's a little bit more risky. So you have to make sure that your surgeon is very careful in certain areas to make sure that the skin contracts down in a uniform way. So those areas that can be risky are sometimes the outer thigh, the posterior thigh, the lateral thigh. Those are areas that really you have to have an expert surgeon if they're going to contour some of those areas, because it's not all about just removing fat. And there's a saying that one of my mentors taught me is, it's not about what you take, it's what you leave behind. And so there is a certain degree of healthy fat that is underneath the skin, and we need to make sure that we preserve that healthy subcutaneous layer in order to maintain beautiful results. So, to simplify things, liposuction is just the mechanical removal of fat. It's a minimally invasive procedure per se, because it's small incisions, and there's all kinds of different techniques. And the most popular, or the old school, is something just called tumescent technique, and that is really what all forms of liposuction are really based upon. And that just means that we infiltrate fluid into the tissues first, and usually that fluid contains epinephrine, which helps constrict the blood vessels, as well as lidocaine, which is some type of a numbing medication. After we let that sit for a few, either seconds or minutes, depending on what technique you're using, then usually with a cannula, we are mechanically removing that fat. I utilize what's called the power-assisted liposuction. That's using a vibration device that allows me to extract the fat a little bit easier. I perform what's called a safe lipo technique, which is popularized by one of our colleagues, Simeon Wall, up in Shreveport. And so, I follow the safe liposuction technique. And occasionally I will use some sort of energy device, and whether that's laser to break up the fat even more and to try to promote some type of skin tightening. Also, what's popular is ultrasound energy, which is termed the Vaser. And again, all of those energy devices, for the most part, are utilized to try to break up the fat a little easier and to promote some type of skin retraction. So, there's all kinds of different forms. There's a lot of different marketing forms, marketing tactics and terms. So, try not to get, too caught up in the marketing aspect of plastic surgery. It really depends on, the surgeon and looking at before and after photos. And, there's multiple ways to get the result. And it really doesn't, it's more of the talent behind the tool. And so, I can get very good results without using energy device liposuction technologies for most patients. And so, we talk about all of that during your consultation. So, what kinds of results are possible with liposuction? Well, liposuction is not a weight loss procedure. And so I think patients who are happiest with liposuction, they are usually within 10 to 20 pounds of their ideal body weight. And, we are targeting areas that are just resistant to diet and exercise, and trying to, get rid of certain areas of fat that are just genetically predisposed in certain areas that are very difficult to get rid of with just diet and exercise. And so what I like to talk about in my practice is usually I try to reserve liposuction patients to a BMI below 30, and that's the body mass index, so that's a measure of obesity. When I do that, I feel like I can get more striking results, and my patients tend to be happier with the result. Here in Louisiana, we can, as an outpatient procedure, we can only suck about 5 liters of fat in order for the patient to go home and do that in an outpatient procedure. If you suck more than that, then sometimes there can be some volume shifts and some hemodynamic changes, meaning blood pressure changes, urine output changes, and that the patient needs to be monitored in a hospital setting. So I keep all liposuction to 5 liters or less in my practice. And so, if you're overweight, then if we suck 5 liters of fat, sometimes it doesn't really make too much of a difference. And so, again, patients who are happiest with liposuction results are within 10 to 20 pounds of their ideal body weight, and we look at it as a sculpting procedure, not as a weight loss procedure. If we think that you need a weight loss procedure, then we talk about diet and exercise first, and we sometimes send you to our weight loss experts who can help you with that if you're having trouble on your own. Okay. So the other question that we get a lot is, are liposuction results permanent? And that's probably the most common question that I get, whether or not results are permanent. And the answer is yes and no. And what I mean by that is, when fat is removed by liposuction, those fat cells are permanently removed. They're not coming back. However, if you gain weight post-operatively or post-liposuction, then the fat cells that remain in that area, they get larger. And so you can still gain weight in the areas where we've done liposuction, because remember, we're not totally removing all of the fat. There's a precious subcutaneous layer of fat that we need to leave behind so that you get a natural, beautiful result. And so there's still fat cells. So you gain weight, the fat cells will get bigger, but those fat cells that were mechanically removed, they are completely gone. So if you gain weight post liposuction, then the fat's really going to go everywhere. It's going to go to, the areas that we did not do liposuction, and it will still go to some areas where we did liposuction, because again, remember, there's still some fat cells that are still there. Okay, so another question is, how do I maintain the results of my liposuction? Well, when you see me during your consultation, we first try to talk about, your diet and exercise program. And I think trying to implement a diet and exercise program, if you do not have one preoperatively, is very important, because if you make those lifestyle changes preoperatively, then you get surgery, then it's easy to get back into those lifestyle changes to maintain your results. I tell all of my patients that this is an investment, and obviously this is out-of-pocket expense. So we want to do everything that we can to have long-term predictable results. And so that means eating a healthy diet, drinking plenty of water, all of the healthy lifestyle habits that we all pretty much know, but sometimes we just don't do. So maintaining a regular exercise program, avoiding excessive alcohol intake, and the other thing is, patients who are in the childbearing age, they ask me, this question: will, children affect my liposuction results? And that the answer is yes. When you have children, going through the 9 months of pregnancy, the stomach muscles get stretched, the skin gets stretched, there's usually leftover fat. So, after that, we have to talk about, what can be done to improve your post, childbearing abdomen or other areas. And so what I tell patients is that, just make sure you're done having children, sometimes before getting liposuction, if you know that you're going to get pregnant within a year or so. But before that, and I'll show you some results, these are all patients who have not undergone childbearing, and those are actually the best patients. So the best patients are within 10 to 20 pounds of their ideal body weight and have not had children for the abdominal area. Okay, so what is liposuction recovery like? That's another common question. And so, depending on what we're doing, it can take anywhere from 1 hour to 4 hours to do liposuction, depending on the areas. It's an outpatient procedure. You usually have some type of, if we do the chin or the neck, you have some type of wrap around the neck. If you do any other body part, then you go home with some type of compression garment. I usually see you back in about 7 days. There is some drainage initially that comes out onto the garment. That usually lasts for about 12 to 24 hours. And you are in some type of compression garment for at least 4 weeks after surgery. I tell most patients it takes about 1 week to, for the soreness to go away, and most patients can go back to work in about 1 week. It's 3 to 4 weeks of really no excessive, exercise or heavy lifting, and depending on what type of liposuction we do, I usually do recommend at some point in the early postoperative period some type of either endermology, which is a mechanical lymphatic massage, or lymphatic massage itself. And I think that really helps keep the skin smooth, and it prevents scar tissue or fibrosis from developing between the skin and the underlying tissue layers. After about 1 month, you're looking pretty good. There still can be some swelling. There can still be some lumpy bumpiness. That's, as the swelling subsides. And, 3 months, 6 months, and even a year, the results continue to get better. So the other question that we get a lot is also, am I a good candidate for liposuction? So I think we kind of talked about that. It's really all of the same things for elective cosmetic surgery. You need to be a non-smoker. You need to be within, usually 10 to 20 pounds of your ideal body weight, and, in relatively good health. And, for the abdominal area, I usually say that if you've had children, then liposuction alone is not the answer. And the reason for that is, again, what we said before. There's, 3 things that happen after pregnancy. You get loose skin, you get abdominal diastasis, which just means the muscle gets stretched, and then you have some leftover lipodystrophy. So liposuction works well on patients who have good skin quality. If the skin has been damaged, then, after we remove the fat, the skin has to contract. And if it's been damaged, then it contracts, unpredictably. And that's where sometimes we see results that are not, that great. It's not because the surgeon did anything wrong. It's just because, sometimes it was improper patient selection. So as a general rule, if you've had children, liposuction alone to the abdomen is not a great option. Obviously, there's exceptions to all rules, but that's a general rule that I tell my patients. Okay. Let's see. Okay, let's go through some results, and then we'll answer some more questions. Okay, so you can see this patient is a patient of mine. She, was doing some diet and exercise, was having trouble, and, was unhappy with her abdomen and her waist. And so, for her, we were able to really define her abdominal musculature. And so, liposuction over the last couple of years has really revolutionized into, the key word that we see all over social media is high definition liposuction. And that was popularized by a surgeon in Colombia, Alfredo Hoyos. And, the main thing was to selectively take out fat in certain areas of the body to really highlight the underlying musculature and anatomy. And so for this patient, I really wanted to try to highlight her abdominal muscles. And so we selectively take out a little bit fat, or we selectively take out more fat laterally on the abdomen, and then as to really sculpt those lines. And you can see that's what we've accomplished for her, is a smaller waist, a more defined abdomen. But the key point is that everything looks natural. If you saw her in the beach, it doesn't look like she's undergone liposuction. It looks like she's, just really got all of those results through diet and exercise. And that's the goal for my patients. You can see the side view. And so the side view here, we've really kind of sculpted her back, her waist, her abdomen to really give her a flat abdomen. Now, if she had children, and if some of that, outpouching of her abdomen was due to, had post-pregnancy issues, then she would not get that result where it's flat. And so the importance of here is, if you've had children, then to get a flat abdomen, then usually we have to repair the muscle, and that's usually with a tummy tuck. But on patients who have great skin quality like herself, we can be fairly aggressive in all areas and really kind of sculpt and define the abdomen in a really kind of, artistic way. And everything that we do is in a 360 manner. And so, my goal for patients is to make smooth transitions from the abdomen to the waist, from the waist to the buttocks, and, from the waist to the back. And so we want all of those body regions to really flow naturally. And I think that's how you truly get a natural result is, from, looking at all of those areas in a 360 manner. So, for her, you can see the bra rolls in the back. We've, flattened out all naturally. The waist is more defined. And for her, I even put a little bit of fat to her lateral buttock just to really create a more smooth transition from her waist to her buttocks. So again, here's another, patient. And this kind of just highlights, when I was in training, we were somewhat just taught to remove as much fat as possible and to really remove it all, not to do high definition liposuction is what I'm trying to say. And so this was really popularized over the last couple of years, and to really try to define the abdomen in an artistic way. So you can see another patient right here is what we've accomplished to really smooth out her back, her waist, her abdomen, and make that transition from the waist to the buttock look smooth. Now again, this is an example of some arms, so we can do really all over the body. When I do liposuction, I really pay attention of where I put in incisions, because even though it's a 1 centimeter incision or less, we want to kind of hide those incisions in natural creases. So for this patient, we sculpted her arms, not removing all of the fat, but to remove enough fat to really get a tightening effect and more defined arm definition. So, some patients say, well, can, skinny patients get liposuction? And the answer is yes. I mean, this patient's obviously in good shape. However, she wanted a more kind of defined athletic appearance. She wanted really her hip bones more defined. And so, for these patients, there's really little room for error. And so we have to really pay attention to make sure that we take, fat away selectively, but we also leave a healthy layer of fat underneath the skin so that there's no negative signs of liposuction. So for her, we lipoed her thighs, her waist, her abdomen, just to get that, crucial finesse definition for her that she was, having trouble defining just with diet and exercise. Okay, so I hope some of that helps. We have some more questions, so let's answer some of that. Somebody asked yesterday, is it true that when you take fat from one place, will it come back in another area? And so I think we've kind of talked about that a little bit, but for those who are just joining us, let's talk about it again. Wherever we do liposuction, those fat cells are permanently removed. And so it doesn't mean that we remove all the fat cells in that one area. So if you gain weight, if you don't maintain a healthy diet and exercise, then you will gain some weight in the areas where we've done lipo, but you're going to gain weight in all the other normal areas as well. So the fat doesn't just selectively go somewhere else. You gain weight like you normally do. You'll just probably gain a little bit less in the areas where we have done liposuction. How long is the healing process? We hit on that already. It's about really 1 week of soreness, and 3 to 4 weeks until you can get back into the gym. What's the downtime and how to avoid lumpy results? I think the best way to avoid lumpy results is really, surgeon selection and, the surgeon picking the right patient to operate on. And so, again, what I mean by that is if you've had children and you just perform liposuction only to the abdomen, then more often than not, you're going to be at really high risk of having, unpredictable results at the abdomen. Again, downtime, 1 week of soreness. As far as avoiding lumpy results, I think it's not only what we do intraoperatively, it's what we do postoperatively. So, I'm big on compression garments. I'm big on some type of mechanical lymphatic massage. I think it helps get the swelling out sooner and create smooth skin contour. Someone else asked, what's the difference between smart lipo or laser lipo and body tight? So again, these are all different types of energy devices. Smart lipo and laser lipo are pretty much the same thing. The smart lipo uses laser. Body tight is not a form of liposuction. It is a form of minimally invasive skin tightening, and it uses radio frequency. And so, maybe for certain areas and certain patients, it could be indicated. However, I think if you're truly looking to get skin tightening and your skin has been damaged, then there's really no substitute for surgical tightening and surgical excision of the skin. Okay, let's see what else. Is a small lipoma under the front bra line an issue? Yes, I think that is a very common complaint for a lot of women, is to have a little bit of fat right in front of the bra line. There are a few options. I think liposuction is the gold standard. Sometimes that's probably one of the only areas where I like Kybella, which is an injection that we can place into that area. It usually takes multiple treatments though. So I think if you really want it one and done, then liposuction is very easy. A lot of times we can do that area under local anesthesia. Can you liposuction the area below the glute? You can, but it's almost what I call a no-fly zone. And so if you liposuction the posterior thigh right below the buttock crease, and that was done, it was pretty popular several years ago, and maybe 10 years ago. And what happened is that as that area healed, then what you've noticed was that it formed two buttock creases. So it's an area that I try to avoid. And if a surgeon is going to attempt it, and if you agree to it, make sure that you see multiple before and after photos of conditions like that and had positive outcomes, because it's a very, very challenging area. Somebody asked about textured implants. Just DM me and we can talk about that later. Today we're just going to talk about liposuction. That's a good question. When will you guys start taking patients again? So, right now, I think the governor in Louisiana hopefully will come on today to talk about, the different phases of starting the economy back. As of now, only time-sensitive procedures can be done. The stay-at-home order in most of Louisiana is over on May 1st. So hopefully we're trying to get some direction this week on when we can really be fully active seeing patients again. So stay tuned, and once we know a definitive answer, I will share that with you guys. Okay, so I think that was pretty good. I hope that answers a lot of your questions. Liposuction is one of the most popular procedures that I perform, and just remember that it's not all about what we take in liposuction. It's what we leave behind. That's crucial. Some patients come in and they're like, I just want all the fat removed, and that is something that is discouraged, because there's a healthy layer of fat underneath the skin that must be preserved in order to produce natural results. Somebody said, do I do ankle liposuction? Of course. Anywhere really from head to toe, we can do liposuction. Again, there's some high risk areas as far as contour deformities and things like that, and so we talk to you about those things. But the ankles are very common. Ankles, calves, thighs, those are very common areas that we can do liposuction. Okay, well, again, as long as we are still not able to fully operate right now, we're going to continue these educational sessions each morning. So if there's anything that you guys you want me to talk about, feel free to DM me, send me a message, and we'll try to get all of those things covered for you. So I hope this helps, and we'll see you tomorrow.